launch webinar for D&A's Connecting, Coaching and Changing Lives program, otherwise known as the C program. My name's Adam Seeby and I'm the current president of D&A, and it's great to have everyone on the webinar here for the launch of this amazing program. There's been a lot of work go into it and we're very excited to launch it because it's a bit of a new initiative. As you probably all know, the last 2 years have been quite difficult for D&A events, so it's really great to launch a different program with a really nice focus on educating and providing mentorship for nurse practitioners and candidates. Just before we start, our executive officer, Colleen Blooms, has told me I have to do the housekeeping, so I better get through this. I've welcomed you all to the program, and you're no doubt familiar with Zoom. I'm sure you're all familiar with Zoom, over familiar with Zoom. Please, if you want to ask any questions, we'll have some time at the end to answer these. Just use the Q&A feature rather than the chat. I think you should be able to raise hands as well. We'll be keeping an eye on that. So we welcome you to come on and talk, but if you want to type along the way, we'll address questions at the end. And all the other obvious Zoom things apply, like being on mute when you're not speaking. I think we're in a webinar, so it's difficult for you, and video off, but just in case you can access those, we just ask that you stay on mute with video off, just to help with presenter bandwidth, and some participants as well might have issues with bandwidth. We've all got our video on. Tends to drain it pretty quickly. Quick acknowledgement of country. As we gather for this meeting, physically dispersed and virtually constructed, let us take a moment to reflect the meaning of place, and in doing so, recognise the various traditional lands on which we do our business today. We acknowledge the elders past, present and emerging of all the land we work and live on, and their ancestral spirits with gratitude and respect. And I'd also like to take a moment to acknowledge participants on this webinar at the moment, particularly those who are working in clinical services who have done it pretty tough for the last couple of years at D&A. We're acutely aware that everyone's been under a lot of pressure in a lot of settings. So I just want to acknowledge that it's been a difficult time, and we're quite humbled and proud to hear the stories of people getting on with their work in some really difficult times. I just want to start by introducing the C program and why we need it. We've got our former president, Darren Smythe, who will talk more to the C program shortly. But as I mentioned before at the start of this is really a mentoring program for nurse practitioners. And it's very much a pilot program. It was based around a little bit of work that we did looking at nurse practitioners, drug and alcohol nurse practitioners across Australia, a survey and some interviews. You might have been involved in those and be wondering where the data is. And it's up to me now to apologise and say it's coming along. Last year was a bit hectic for all the reasons you're probably aware of, but we're in the process of writing that up now. So we went through the survey process. We interviewed 29 nurse practitioners and 14 candidates in the end in a survey, and interviewed 12 nurse practitioners and 2 candidates, via interviews. So 29 in a survey and 12 in interviews to really look. The survey was about demographics and what people were doing, and the interviews were really to look at some of the barriers that were faced by nurse practitioners working in drug and alcohol, and candidates as well. I think across the board, as we'll talk about, there's significant barriers to the uptake of nurse practitioners in Australia, which is a real shame. I mean, we're going through a time in Australia where we're talking about things like service integration and what a great idea that would be. And there's probably people on this webinar who are in areas where integration has been done poorly, but the nurse practitioner probably stands at a really critical junction for a good model of integration, in my belief anyway, where we incorporate mental, physical health along with drug and alcohol treatment all in one nice little model. So the nurse practitioner model itself, I think, is a very, very good way to do that, to provide that integrated holistic service. These are our nurse practitioners that responded to us in the survey. And as you can see, there's a few pioneers there from 2003 and 2004, but largely most people are becoming nurse practitioners. This is the years that people were endorsed. We asked people when they're endorsed from 2015 onwards. So it's very much the drug and alcohol nurse practitioner. And I know there's a few people who've been doing it for a very long time and, are very, very skilled, adept in this area, but there's a lot of people who are coming into this area now. As you can see, we only went up to 2019 because we did the survey in 2020. So a very new profession, really or endorsements, sorry, looking at the last 5 years, you can see that there's been a bit of a growth. And I suspect if we were to look at 2020 and 2021, the interest in this program is showing that there's a lot of people moving into this area as well. Our interview participants were mainly across the Eastern Seaboard, some in Adelaide, as you can see there. Lots scattered through Victoria, quite a few around the Brisbane area, and this isn't necessarily mirroring nurse practitioners in Australia. We do know of a few who are working in remote and rural areas. We just didn't get the survey to them, so this is really just participants and where they are. But the real difficulty about this is that APRA to date haven't really kept good records on drug and alcohol nurse practitioners. When we did the state of the workforce, when we looked at our workforce across Australia and New Zealand, in Australia, we were able to look at APRA data for drug and alcohol nurses and kind of look and go, oh, there's 2002 of us at this point in time. But unfortunately, they don't extend that to nurse practitioners. So we're a little bit in the dark. I'm hoping that they've changed it recently. We also asked people, we had 26 people respond to this, 26 qualified nurse practitioners, endorsed nurse practitioners, what they were doing in their practice. As you can see, mostly doing alcohol and opioid pharmacotherapy, and then it kind of moves down from there through withdrawal management, hepatitis C treatment, telehealth. I dare say again, we did this in 2020, so we did it in 2022. Telehealth might go through the roof, I suspect. Through chronic pain management and a few other functions. This is just a brief overview of this data. There's a lot more depth in it, and we're hoping to get it out in the form of a fact sheet shortly so you can have a better look at it. And then, as I mentioned before, we did interviews. Ignore my typo there were 2 candidates, not 12 drug and alcohol endorsed nurse practitioners. And at the moment, as you can see down the bottom, this is a paper that's in prep. So in preparation, we're looking at this from the lens of barriers to actually taking on nurse practitioners. We did qualitative interviews around this, pretty interesting data when you sit down and look at it. The biggest thing that really came out of it was the lack of available roles. So people go off and they invest in money, of course, in a master's degree, also time. It's a lot of effort to get your master's degree, go through this process and can't find a job basically as a nurse practitioner. There's a lack of available roles. Some people had mentioned that they'd gone through with the promise of a role at the end from their organisation. And then, of course, they were hesitant to take them on. They had to justify the role. The onus was really on them to prove that this was a valid role and a valuable role for a health service. There's also a lot of commentary around organisational capability to take on nurse practitioners once they were qualified and endorsed. Who's going to look after them? What kind of scope of practice? What do we need to change in our policies and guidelines? So that was a significant barrier as well. And probably the thing that was most disappointing reading through these interviews was the lack of awareness or trust in some cases of nurse practitioners in some settings and by other health practitioners. There's one comment that stood out quite starkly to me reading these interviews and to the person who actually conducted the interviews, and that was a nurse practitioner saying that, you know, they'd spoken to a doctor on the phone who'd basically dismissed them, saying, why would I have a nurse deal with this, and hung up on them. And that was quite disappointing to hear that. But saying that, there's probably a lot of opportunity here, and this is where our work's focusing at the moment. I mean, those are obviously, I hope they're outliers when you get responses like that people are dismissive. The nurse practitioners, the candidates, the people who've become endorsed have come to this role with extensive experience, often working at C&C level for many years, pretty much at a pretty high level in drug and alcohol services. Brought a lot of skills with them, much like our overall drug and alcohol nursing workforce. Worked in a lot of other areas, a lot of advanced skills. They rate themselves as highly capable to perform advanced interventions. And as I mentioned before, their capability to provide holistic care, including physical and mental health, it's often unmatched in settings that we work in. I think the nurse practitioner role, we really need to be shouting it from the rooftops. But again, I'm probably preaching to the converted, aren't I? You all know this. And this is where really the foundation for the CCC program has come from, the mentoring program. I'll just say one last thing because I'm about to go over time and will get myself in trouble. This program's a pilot and we do need your help to evaluate it. So participants, you will get an email soon asking you to complete a survey before you start the mentoring sessions. and immediately after the last session, talking about your experiences and how competent you feel you are in looking after people who use drugs and alcohol. And we're also going to run some interviews as well. And we're really interested in your suggestions to how the program went, how it's changed your practice, and how we can improve it in the future. That's probably the most important part. This is a pilot program, and we would love your input to tell us how we can get better at running this. We're hoping there's many more versions of this program in the future. And I will now hand over to Darren Smythe. He's a nurse practitioner, past president of the Drug and Alcohol Nurses of Australia, us, Dana. He was the driving force behind the inaugural Australasian Drug and Alcohol Nurse Practitioner Symposium, held in conjunction with the annual Dana Conference in Sydney in 2019. Emerging from this event was the establishment of a network of supportive relationships and the formation of Dana's Nurse Practitioner Support Committee. It was within this context that the concept for a series of clinical support and mentoring workshops to assist newly endorsed and aspiring nurse practitioners was first explored. So I'll hand over now to Darren to provide a bit more information on the program.
Certainly raised some good issues there in how we sometimes feel as a nurse practitioner with certain medical colleagues, and I'm sure every nurse practitioner that just heard that had a few memories run through their mind. So let me get started. So thank you and welcome to the launch of the Coaching, Connecting and Changing Lives pilot program. So, sorry, I'll just get this. This all seed started to grow a few years ago with Dana, and basically looking at what can we do to reduce this sense of isolation that many of us feel as a new nurse practitioner, especially at the beginning. And this seed then started to grow. So what happened? So look, Dana, drug and alcohol nurse practitioners, and myself, first and foremost, would sincerely like to thank AbbVie for their generosity and insight regarding the substantial contribution that nurse practitioners provide to the healthcare delivery in Australia. After many discussions with AbbVie, we find ourselves here today, launching a novel, innovative program that we hope continues post the evaluation. Moreover, to ultimately provide education, support and mentoring. And furthermore, Dana's aim as the peak drug and alcohol nursing body is to provide a consistency in the delivery of safe and effective patient care that is evidence-based, driven by peers, to establish and strengthen the current and future generations of drug and alcohol nurse practitioners. So intro, so hello and welcome everybody again to the launch of the CCC program. As we said, Dana, with the assistance of AbbVie, is very proud of this program and the outcomes we hope to achieve with those participating. And I'm not really aware of any other nurse practitioner programs like this within Australia. So hopefully this has great success and is then expanded amongst other nurse practitioner cohorts. I know personally what it is like to wade alone through the online nurse practitioner masters, as many of us have done and some of us are doing now, as the only drug and alcohol nurse. I know what it is like to be employed as the only drug and alcohol nurse practitioner and fell out of my depth and experience imposter syndrome. For those nurse practitioners joining us tonight, I'm sure you remember what it is like when you were first starting out. So many questions left me with a sense of unknowing and not sure where to start my search. You don't know what you don't know, right, until you do. I also now know many of my peers also felt the same. I knew I didn't know everything and was waiting to be found out. I desperately needed support, encouragement, and guidance. I made some avoidable mistakes, or it took longer than it should to complete certain tasks without that support. So mentees and mentors, you are our test pilots, as we hope this program provides you with what you need and continues in the years to follow. We won't know everything, but we promise to try and find out and point you in the right direction. We are here to support you through your studies, and no, that doesn't mean completing your work for you, so don't ask, but by perhaps linking you in with others in the same boat, supporting you if you have commenced employment as a drug and alcohol nurse practitioner, and allow you to lean on those of us that have gone before you. We're also very aware of the knowledge and skills that you also bring to this program, and I'm sure I'll learn some things from you also. So the origin, as Adam mentioned before, the inaugural Australasian Drug and Alcohol Nurse Practitioner Symposium held in conjunction with the annual D&A conference in Sydney 2019 was where it sort of really took off. This was the first time in the Southern Hemisphere that nurse practitioners working in the alcohol and other drugs sector in Australasia were invited to come together for an educational event. Our numbers have grown, continue to grow steadily since, and I think as Adam highlighted in 2019 when that research was done, there have been considerable amount of nurse practitioners entering the drug and alcohol space since. So many requests were made on that day at that inaugural symposium. So emerging from that really was the establishment of more supportive relationships and networks and between senior MPs and newly endorsed MPs and those working towards endorsement. So the things that did come there was that Nurse Practitioner Support Committee. You know, DANA's Nurse Practitioner Support Committee was established following that event to drive issues raised, and this has successfully continued to this date with regular meetings, even in the face of COVID. If you would like to actually join this committee and contribute, please let us know. We'd be happy to take on more members. And remember, if you're working towards a nurse practitioner endorsement, joining national committees is required and acknowledged when applying for your endorsement. So jump on board and help out. It actually might help you out down the track. Private practice, another point in the area that was raised that day was many delegates sought knowledge and clarity about transitioning into private practice. How do we do it? What do? What we don't know what we need to do. In response to this request, DANA developed the private practice manual for Australian drug and alcohol nurse practitioners to assist MPs just achieve that. It's a great piece of work and it's located on the DANA website. Moving on, also that originated from that day was the nurse practitioner survey and research that Adam mentioned previously. I won't go into that significantly because Adam touched on it, but it was another thing that was really launched from that day. And we hope to see some fantastic publications come from that research down the track. The last thing, which is why we're here today, that did originate from there, was that further, a lot more people requested on that day the development of a support program to assist the newly endorsed and those working towards MP endorsement, like an internship, like the medical fraternity offer. I think that's the simplest way to put it forward to some people, the things that were severely lacking, and you can understand what I'm saying about an intern program. However, what really stood out was that people wanted education and peer support to assist them through this new and at times scary process, so they didn't feel they had to face it alone. The DANA-led MP survey, originating from also from that symposium completed in 2020, also highlighted the lack of processes and systems established to support the MP role. This led with Abby's support to the development of the DANA CCC program. So what does the program consist of? Well, I'm just going to give you a very basic outline here, but it is predominantly 6 interactive educational webinars. So the educational webinars and the support webinars will be run together. They are 45 minutes each, covering a 90-minute session. So the interactive educational webinars will be facilitated by an experienced drug and alcohol nurse practitioner with input from a clinical expert who will be running that particular educational session. It will put forward on that particular topic set. Each webinar will have a set of pre-reading and ongoing knowledge assessment, a 10-minute question online quiz, and the last being a face-to-face and virtually from the conference in Adelaide, where I really look forward to meeting you all for a great photo op. Followed by that, as I said, within that 90-minute time frame is the peer support webinars. The peer support webinar, these are closed groups. So the first one, the interactive one, is an open session where anybody can join in. The second one are closed for those that are within this program to address the many topics that the mentees have raised and a select group of case studies for inclusion. These will be closed group owned to basically the sensitive nature, and we really want to see how this has an impact once it's evaluated. These will be facilitated also by an experienced nurse practitioner using a semi-structured approach and guided when required. And things we're going to be covering in those, apart from the educational webinars, are things like OTP assessment, hepatitis C diagnosis and treatment, clinical skills, pathology, pharmacology, and so forth. So it can really assist you gain those further skills. Followed up also as part of the program is the monthly group mentoring sessions, and they will be run also monthly in between each of the interactive educational ones. Mentees will join a small mentoring group with a mentor and others enrolled in the program. As I said, it will be monthly. The content of these sessions has been roughly determined by the mentee also requested topics, and we did receive a considerable amount of topics that those entering the program want to do, and things may change each week as well. This will hopefully come out down the track, you know, whether we've been able to meet all your requirements, but we're hoping to cover as much information as possible. Okay, so look, the aim of the program, as I said, is to provide participants with an opportunity to gain confidence and competency in drug and alcohol treatment, as this is open to nurse practitioners that don't work in drug and alcohol also, to start to build their evidence base in the treatment of various substance use disorders. So it's to help you successfully sort of transition from that, you know, I've been an experienced nurse, now I'm a nurse practitioner, I feel like I'm back as being a novice, but we're going to help you move forward so you build that confidence, which I'm hoping you will look forward to. So as I wind up myself, the meet and greet session, which will be open to the clinical experts, mentors and mentees, will be on March the 2nd. Colleen will be sending you out some email correspondence shortly. And as Adam said, you'll also receive a survey or questionnaire, which should fill in as a pre-survey prior to us commencing. That you'll get very shortly. And I also wanted to discuss the D&A Drug and Alcohol Practitioner Symposium and Annual Conference, which will be held in Adelaide on the 3rd, 4th and 5th. We hope that all mentees, mentors and clinical experts are able to join us and meet in person. And as I said, get amazing photo shoot for this really novel program. I really hope we push that around to the various universities, chief nurses, all those people to show what an amazing program this is, and hopefully they can support it, that as nurse practitioners we can look after ourselves.
Thanks, Trisha. And that brings us to the end of our presentation. So we've now got time for some questions. And before we start, I just wanted to take a moment to acknowledge the work of Jason Harrison. He's our portfolio manager at D&A for nurse practitioners. He's also the chair of the D&A Nurse Practitioner Subcommittee, an active member of the Australian College of Nurse Practitioners, and he's been actively pursuing the advancement of the nurse practitioner role within the Australian healthcare sector. And he's been pretty influential in developing a lot of hard work along with Darren in developing this program. So I just wanted to acknowledge Jason. Thanks, Jason. I've got a question sitting here from anonymous attendee at 6:05. And I'm just looking back and thinking that this question was probably in relation to the slide that showed our survey results where people were saying where they were endorsed. And the question is what happened in 2018, but it's hard to tell. As I mentioned, we don't have the APRA data. I'm hoping we can get it at some point if they start collecting it or release it. So we're really just relying on self-report here. So maybe that we had more endorsed in 2018 in drug and alcohol, but very difficult to tell. So it's obviously a limitation of our research. And just a question for Darren, are there any plans to expand the program beyond nurse practitioners in the future?
I suppose it might be good to wait to see what transpires at the end of this program. I mean, it was really built on the fact that when you become a nurse practitioner, you really are out there on your own. And it was built from that, you know, wrapping some support around that person, providing some education and giving them some information to help that transition, which doesn't really happen in the other areas. But however, that doesn't mean that down the track, something else can't come from it. Who knows what the evaluation may reveal, that we may be able to have some little subgroups, but you never know. I suppose watch this space. This is a new program itself that we hope really is quite successful. That will, you know, it's going to be, I suppose, a bit of a trial and error year also. So, you know, how it looks down the track might be completely different. So, yeah, you never know.
Just a reminder to either use the hand up function or the Q&A if you'd like to ask questions around the program, around Hep C treatment, anything that we've covered tonight. Another question. Do you think there's a need for the program outside drug and alcohol settings? And I know you previously had hinted at this, but I suppose the extension of that is, how do you see this program being applicable outside drug and alcohol settings?
In relation to other nurse practitioners?
Yeah.
Well, I think that's what we were highlighting before, that at the end, we hope that, and that's why I sort of highlighted that if you try to equate it to something similar, it might be a little bit like a very much a small abbreviated version of an intern program for doctors when they come from uni and first start working out in the clinical field. Look, I know that there are various hospitals that have little nurse practitioner programs, but it's much more sort of in-house for those. Obviously, we're covering Australia for those that aren't drug and alcohol nurse practitioners, and those that are in their training, and those that have been newly endorsed. Well, hopefully at the end of this valuation, if we have some fantastic results, we can put that, you know, throw it back out to the Australian College of Nurse Practitioners, take it to CONMO, you know, the Coalition of National Nursing and Midwifery Organisations, show it to the universities, the chief nurses and so forth, and see whether this is really up to those other nursing specialties, whether they want to adopt something or, you know, I suppose something similar moving forward.
We've got a hand up from Lan. I don't know if that's your domain, Colleen, of unmuting people. The behind the scenes stuff.
And I can't even see for you to do it in sign language, Lan.
It's a question for me. I'm happy to answer it on the chat.
We've got a couple more hands up while you do that. Berglund.
Hi, sorry, it's Berglund here. Can you hear me?
Yes,
we can.
Oh, good. I was a little bit late to this course. So is this just a course for hepatitis C treatment, or is it actually a alcohol and other drug sort of course to mentor people in that process? I've probably missed the start, so sorry.
Yeah, you've sort of mixed the crux of it there, Berglund. It's called the Coaching, Connecting and Changing Lives program. It's a 6-month program for newly endorsed or those training to be drug and alcohol nurse practitioners. It's a support, mentoring and clinical sort of education program to support those people transitioning into a drug and alcohol nurse practitioner.
Oh, okay. Is it for, because the presentation just before was just on Hep C.
That's because, as I was saying before, AbbVie, where drug and alcohol is an area that very much has a holistic primary care focus, where we're looking at sexual health, dental, vision, mental health, and so forth. And AbbVie has kindly helped us financially to develop this program, because hepatitis C is one of those areas we want definitely sewn into the normal practices of drug and alcohol assessments by drug and alcohol nurse practitioners, the screening and assessment. Okay.
Yeah, just because, sorry, I'll keep asking, is just because of my background is in viral hepatitis. My keen nurse was obviously more to gain greater knowledge in the drug and alcohol scene.
Sorry, what was it? I think I've met you, Berglund, from Brisbane, aren't you?
Yeah.
What was your question?
It was more to do with, I was hoping this would be like a mentorship for the drug, like for, you know, the program that you are really experts at, and that's the drug and alcohol thing.
It is.
Good. Okay, just making sure I was in the right.
No, but we're just showing, we're being mindful that, nurse practitioners sort of scopes of practice are broadening as well, but it's
Yeah.
also really important that it's a normal, natural inclusion of every drug and alcohol nurse practitioner is looking at screening and assessment of bloodborne viruses and hepatitis C. So it's reinforcing and educating and so forth, the new next generation.
Okay, excellent. Thank you.
Thanks, Virgil.
A good seg into a bit of a question. If you could give us an outline of what you cover. I know, is it alcohol that's the first session? Maybe just give us a little outline of what you're covering. I think that kind of leads on nicely from that comment.
Well, I suppose the first session is alcohol. So it'll be Jason and I that will run that interactive educational webinar. We'll have a clinical expert, which is Stephen Ling, coming on, providing a presentation on the management of a patient that has an alcohol use disorder. That may be in, for example, an outpatient setting, consultation and liaison, rehab. So bringing together the sort of the breadth of knowledge of drug and alcohol nurse practitioners. There'll be a question and answer part at the end, but a lot of it is looking at that assessment part, and also how do you intertwine hepatitis C management when you're looking at the mental health, physical health, drug and alcohol. And then there'll be question and answers at the end of that. And then obviously the next session, which is the closed session, which is that clinical support, will possibly go over some of that clinical experts case that we've just heard, but also various other topics that the mentees have asked for us to explore and discuss during it. So it's and then each of those 6 interactive educational webinars will have different subjects going from alcohol, benzos, cannabis, methamphetamine, opioids, and then really looking at hepatitis C in its whole. We really want people to just abroad this knowledge. For many years now in drug and alcohol, we were told very much it's not part of your scope. However, we're finding more and more now that management and so forth are backing away from that, and it has become part of the treatment and something that we look at as drug and alcohol nurse practitioners. So it's building knowledge on drug and alcohol, building knowledge about Hep C and about other areas as well.
Excellent. And I can see Lee's got a hand up there, but there's a question here. I wonder if this is an extension of your question about CPD points. Do we get CPD points for being a mentee that can go towards our yearly registration? Oh, and Lee's here now.
Hi, can you hear me?
Yeah,
Yep.
Lee, yeah.
Hi, Darren, how are you?
Good, thanks.
Good. No, it was just about CPD points for participating, whether we get any of those sort of points that can go towards yearly registrations and things like that, but also just to say I'm very excited about it. I think it's a great idea what you put together, because I think that it is lacking really, as someone who's just become endorsed in the last year and trying to pave my way. It's sort of, you can feel a little bit isolated, so I'm looking forward to participating, and I think it's a really good idea.
Oh, thanks, Lee. And answer to your question, look, if a mentee attends 80% of all those things, does the pre-reading, completes the quizzes, attends those interactional webinars and the mentoring sessions, at least 80%, you will be issued with a certificate. You can print out what your requirements were, your hourly requirements. We're not saying it's worth so many points. Yeah. You need to actually compile that together, and then you can actually stick it in your CPD folder.
Wonderful, thank you.
Another question. So you talked about what is covered in terms of the content, but you mentioned before there's discussion in each session. I'm just wondering if you can give us a bit of an idea of what that discussion would look like and how it would benefit the mentees.
Which section are you talking about?
So you talked a little bit, when you talked about alcohol, you're going to cover certain areas, but then you said there's a discussion at the end of each session, online session. Just wondering what that looks like.
If you just look at the interactive educational component where we discuss a particular topic, so alcohol being the first one, it will go for 30 minutes. There'll be question and answers after that. That's the complete 45 minutes. Then those people that aren't part of this program will leave. Those that are part will stay on. We will then do a clinical support where we can discuss the case study just raised, or talk about particular topics. as I said, the mentorees, when they applied for this program, had to basically provide a list of various areas they'd like increased knowledge on, which might be anything from your HPOS account to MBS and Medicare, to provider numbers, to medical software, to various, HCV screening and management, OTP. We will set aside a particular, perhaps 3 or 4 of those topics per session, where we will discuss so you get as much as possible. We're also in that mentoring one, which is in the off month, where you have your much smaller group with your mentor. If particular issues come out of that cannot be, I suppose, sorted out and managed during that time, they can be just actually raised in that second component of that clinical one in what we call the clarification hub. So they are fairly well structured because we're trying to get people to get as much as possible out of them but there is a lot of openness for discussion.
A question here or a comment here from Simon. I've nursed for about 43 years and worked predominantly in rural, remote area nurse. 12-year background in acute and community mental health. Not a nurse practitioner or a candidate. Will the program work for me? And I think this kind of hints at what you were talking about earlier on expanding the program. And just to extend on that, again, will we be able to have this program for people like Simon in the future?
Yeah, look, it's hard for me to answer that one at the moment. As I said, it's originated out of people becoming nurse practitioners and not having the support initially. So it's to build that knowledge base for them. I'm not sure what will happen down the track. It depends on funding, depends on who's able to run it, depends on how this one goes itself. But this one was started purely for that need of, which I hope I was able to sort of address through my presentation, of people feeling like they didn't have support when they first started as a nurse practitioner.
Another question from an anonymous attendee. Given that there are different state and territory processes and treatment options across the country, we have content presenters from a variety of jurisdictions.
Yes, there are people from different states. We'd also will be referring people back to when we actually developed the private practice manual, which is found on the D&A website. We have very specific jurisdictional guidelines and what you can do in this state, what you can do in this state, what you need to do in that state. As we said, we won't know it all, but we can hopefully point you in the right direction so you can actually get that information. Most guidelines on substance withdrawal are fairly similar. We do have quite a few national ones also, but most of them are fairly similar with some mild differences really in the treatment aspect.
Fantastic. Any more questions? Last call for questions. We've gotten through quite a few, haven't we? So hand up earlier that I think I missed. Namusa.
Can you hear me?
We can.
It's not a question as such, it's just a comment to say thanks for providing this opportunity for us, especially as I'm newly endorsed nurse practitioner. I remember calling Darren when I was really first started and confused. And also just to bring together with Hep C, I think that's great opportunity for us, because I remember when I first started working in an AOD clinic, I came across patients with Hep C, and I was like, do I treat them? Who do I refer them to? So I think it's a great idea to bring both together.
Thanks, Namusa.
Thanks.
Hand up from Simon. I can see you on the screen, but
yep, good. I've unmuted you. Thank you for your comment about, in response to my question, is more in respect that working in remote Aboriginal health and rural health, as I have done predominantly for 30 years with that 12-year period of working in acute mental health services in South Australia, we see a lot of alcohol-induced hepatitis and other drugs as well. And it's, as working as a generalist, it does take up a large proportion of my clinical practice, working and with very limited clinical support, you know, we do have a doctor, but that's they're not on site in a lot of the cases. So it was more in relation, my question was more in relationship to people who work in these remote areas and how this program could work for them. But I kind of get the impression you answered that for me when you said that it's more for people who have that clinical support rather than people who don't have, who have very limited support at all. Am I fair in saying that?
No, it's not about the support. It's about the new nurse practitioners when they come out do not actually have the support. We're here as experienced nurse practitioners to assist them with their transition into newly endorsed drug and alcohol nurse practitioners.
Unfortunately, those positions don't necessarily exist, and that you have to be everything to everybody, so they're not necessarily going to endorse would endorse you as a nurse practitioner. So that kind of answer, I think you've answered my question for me.
Oh, thanks, Simon.
Which is unfortunate, because I don't then think the program may be well, it'd be appropriate because I'd learn a lot, and but I don't think it's where you want it at this point for my skill set or skill needs.
No, not at this point, probably. No, maybe down the track when it changes.
It is a pilot, so there's probably a fair bit of need from lots of segments of our nursing world for programs like this. The pilot is about really getting the mechanics in place, and hopefully we can extend it in future.
Thank you. I'll be watching it closely because it sounds fantastic.
Keep an eye on our website.
I may be 61, but I still got quite a number of years of wanting to and able to work in this profession. So I think it'd be great. Thank you very much.
Just some final questions about whether the educational webinars will be recorded in case participants miss them.
I'm not quite sure if they're recorded at this point, but as I said, there is an 80% attendance requirement for you to receive a certificate, and attendance at those is a requirement of the program.
Fantastic. And that comes to the end of our questions. I just want to take the opportunity to thank everyone tonight on behalf of DANA. Thank Darren for talking about the program. Thank Mike and Tricia for their insights into hepatitis treatment, and thank Colleen for pushing buttons behind the scene and keeping us all on track. I look forward to meeting all of the participants and mentors in Adelaide, along with everyone that's here. We haven't had a conference for a couple of years now, as you might have guessed, so we're really looking forward to seeing everyone face to face. And details of that will be on our website soon, including a call for abstracts. So if you want to present any interesting research or what's happening in your clinical work, we'd love to have you. Thank you and have a good night.